today class, we will now be discussing about your clinical chemistry. So we will now be tackling about the sections of your laboratory, okay, which includes your clinical chemistry, clinical microbiology, hematology, and even blood banking. Okay, we already discussed the microscopy wherein you studied the urine and feces. Okay, so let's start on your clinical chemistry. So for your clinical chemistry, so this is an area wherein you do laboratory tests in order for you to detect enzymes, chemical aspects of your blood. Okay. So first we define your laboratory medicine. So laboratory medicines refer to the discipline involved in the selection, provision, and interpretation of diagnostic testing. So not only we do your testing. Mainly we do the selection. How? On the selection, we do um, we do your selection of your specimen. How? So for selection of specimen, of course, you instruct the patient, you collect the proper specimen in order for you to have an accurate test, right? So you select the proper and right specimen for your test. Next, provision. What do you provide? You provide, okay, you provide now the laboratory result, which means now you provide vital information for the healthcare, no? Specifically for physician. Bakit physician? Okay, first, of course, physicians are those who will diagnose the patient, and your laboratory tests are the additional data or information that we needed in order for them to establish their specific diagnosis, and they will provide treatment for the patient. And also, you also provide the report and the services to your course patient. Okay? So, yun yung dalawang pinaprovide natin. Then, ano pa? We interpret diagnostic testing. So, you don't just give the laboratory result. So, you give the laboratory result to the physician with interpretation. Okay. So, how is that so? Sabi natin, bawal tayo mag-interpret ng result. Yeah. Okay. We don't interpret the result in front of the patient, but we do indicate interpretation of your laboratory result specifically in your report. How? O kunyari, for example, for clinical chemistry section, we include high value. No word high or low. Okay, so example, you do have, you test sodium, potassium. Okay, your electrolyte. So lalagay mo doon. Your sodium is high. So sabihin mo, ang result is 6.2. Then you do have a note there, high. So you provide interpretation how based on your um, based on your data, of course, your interval or your normal values. Then, no? Ano pa meron ginagawa natin? As to your laboratory medicine. Now, this also entail us your analytical testing. So, how do you do your analytical testing? This is the measurement of your analytes within the possible blood, okay, or even in other bodily fluids. So for research, of course, we don't just do specimen testing for your patients. We also do specimen testing for researchers. No? We do help in establishing information with regards to evolving methods. Also, we do teaching activities like we're doing now. Okay? You are learning from us, the methodologies, the specificities of your laboratory testing. And of course, how do we teach the teaching activities affect your support team? Of course, a lot of individuals are doing now is your CPD. Ano yung CPD? Continuing professional development. So, in order for you to be competent in your field, you need to continually, okay, take education, and this will entail you or give you more information, advancement on your field, okay, that will provide you um, advancement, of course. So you are in trend, okay? Okay. So next we do administration. So, yeah, we also do administration. So hindi lang porket laboratory medicine wala tayo, o puro lab test lang. Okay? We also do administrative how, of course, more on the laboratory manager for your head of the laboratory, okay? Or even the chief medical technologies. They will do administrative work specifically for your procurement, the um, organizational activities, no? So, ayan. Then we do have clinical services, especially mga lab tests, okay, healthcare services that we provide to patients like blood donation, um, your laboratory testing, okay? So, yan mga yan. So let's go now to your clinical chemistry section. So, your clinical chemistry section deals with the biochemical or biological chemical processes associated with health and diseases. So, more so, this provides us information with regard to your chemicals inside the body, okay? Such as your electrolytes, okay? Electrolytes, no enzymes, okay? Ano pa? Your analytes. Okay, more so these are your chemicals inside the body. Okay, ano pa yung mga example niya? So, for example, your electrolyte, sodium, potassium, chloride. Okay, sodium, potassium, chloride. Even on your enzymes, you have ALT, AST, okay? You do have amylase. For your analytes, so you do have creatinine, the mga metabolic waste products, creatinine, okay? Uric acid, okay? Those are found in your clinical chemistry section. So, this measurement of constituents in bodily fluids or tissue to facilitate diagnosis of disease. As I said, we do provide supporting information to physicians in order for them to stabilize their diagnosis. Then monitor the effects of treatment and measuring drug levels in the blood and other bodily fluids. So how do we monitor the effects of treatment? We measure the drug level. So as to this, we do have an example of here, your digoxin. So your digoxin is a medication for heart. And this is being monitored by your physician. If you are taking digoxin for heart problems, okay, this is being monitored and being tested inside the lab. Okay, this is evaluated in the laboratory in order for the physician to know the drug level if you are possibly going into the toxic state. Okay? So, ano ba mga ginagawa natin sa clinical chemistry practice? So, we do have tools and methodologies in order for us to evaluate our bodily fluids. Okay, and what are those? Theory and practice of reference interval. So, this reference interval, okay, are the normal values. You have in order for you to interpret if the analyte that you are testing is out in the normal, or it is high or low, or beyond normal, okay, or lower than the expected normal value of your blood constituent. Okay? So sabi nga natin, ano yung mga yan? So kunyari, for example, the electrolytes tayo, dahil ito yung mga common na tinitest. So kunyari, for example, si sodium, you have reference value of 2 to 4 milligrams per deciliter. So for example, ganyan. Okay? So that's the normal value. If ever that you are have a high result. If you are lower than 4, you have lower result. No? Or in medical terms, hypernatremia because you do have sodium, or hyponatremia. Hyper and hypo denotes pag hyper, of course, you do have elevated levels. Pag hypo, you do have decreased levels. Okay? So, natremia. That is for your sodium. Kaya Na yung symbol. Okay? So, yan mga yan. Ano pa? Use of internal quality control and proficiency testing. So, I already discussed this in your previous topic. So, internal quality control and proficiency testing. So, this will provide you a higher specificity, higher laboratory sensitivity as to the results of your test. Okay, you provide more accurate results on your patients. Then, introduction to automation. Of course, we don't do any more conventional methods in order for us to determine clinical analyze. So, hindi na tayo masyadong nagpapipet, nagmimix, okay? Hindi na natin inaantay pa to have a reaction. So, more so, we do put it on a machine, then the machine will test it for us. Okay, unlike the conventional methods that we are using way back in times. Okay, then we do have the concept of diagnostic testing. In order for you to perform a diagnostic testing, so you need to know the concept of it. So, for example, the specimen consideration and collection, you need to know what are the specimens that you need to have in order for you to perform this test. Okay, so for example, specific, you do have a coagulation testing. Eh, anong ginagamit sa coagulation testing? Or on the blue top. Okay? E paano kung nilagay mo sa lavender top? So, mali ka na doon. You don't know how to do your diagnostic test. Okay? So, kaya naman, ang order sa'yo is evaluation of HbA1c. HbA1c. So, this is your blood sugar or hemoglobin, glycated hemoglobin. No? So you evaluate the hemoglobin, the glucose content on your hemoglobin. So this is a 3-month long evaluation for your glucose. No? And this is not tested using a serum separator tube or yellow top or red top. Okay, this is being collected in a lavender cup. So not all of your specimens are in clinical chemistry deals with serum or plasma. You do also have this kind of with whole blood. Okay, so those are your tools and methodologies for your clinical chemistry. So next, you do have units of measure. So in order for you to perform accurate, and reliable test results, okay, to provide patients, you need to report it as accurate as possible. So more so, you use this, units of measure. So what are these units of measure? So in reporting your laboratory results, so this is your expression of the values inside the bottle. So what are these? So for example, for your concentration, you can report moles, okay, even percents, for the substance concentration inside the blood, okay, or even the other bodily fluids, or even the mass of the substance using your milligram per deciliter, gram per deciliter, gram per liter, milli equivalent by liter, or even international unit, rather than your SI unit. Okay? So, ayan. Okay, analyze must be reported using moles of solute over volume of solution. So, more of the analytes are being reported in your millimole per liter bud, no? You do also have conversion to milligram per deciliter to millimole. It depends on your analyte that you are converting. So, for example, for glucose, from milligram per deciliter to millimole, you convert it to 0.001 order for you to have, so for example, you do have 3.2 milligram per deciliter. So multiply it, divide it to 0.55, so you will get your millimole per liter. So liter is also used as reference volume. Bakit kaya puro liter? Kasi your blood is quantified as liters. Okay? We do have an average volume of your blood from 5 to 8 liters inside the human body. Okay. So in clinical chemistry, we also have your patient preparation. So as I said, no, you need to know diagnostics, concept of your diagnostic testing. So specimen consideration and collection. So how will you do that? You need to know what are those tests that require fasting or special instructions to patient in order for you to perform the test accurately. So for example, you're fasting. So more so it is between 8 to 12 hours. So it depends on the test how much time you need to do the fasting. So for example, here you do have your FBS or your fasting blood sugar, which is commonly done no 8 to 10 hours. Okay? Same as your glucose tolerance test, which is also 8 to 10 hours. Your lipid testing, which includes your cholesterol, triglycerides, okay, your lipoproteins, no, which are your LDL, HDL, okay. These are usually being done and up to 12 to 14 hours. Okay, so gastrin and insulin, of course, your gastrin is your enzyme being found inside your stomach acid. Okay, so before you need to fast before to do this test because if you are currently um, within, no, after eating period, you have a higher tendency to have a higher level of gastrin. Even in insulin, of course, your insulin is initiated with eating. So if ever no, those analytes are being tested, uh, you need to require fasting for patients. And more so, your fasting, no, it depends on the institution. So some institution, okay lang sa kanila na may water intake, but some institution also refrain from water intake. So depende sa machine na gamit nila. Okay? And depende sa iniinom mong water. So for example, ang iniinom mong water is Pocari Sweat. So it will still contribute to the levels of your glucose. Okay? Yung mga ganyan. Yeah. Then you do have diet. So metabolic product, food can increase venous blood. So ano yung mga yan? So some of the diets are high protein diet. So it will affect your protein testing. Okay? The tests most affected are glucose and triglycerides. So ano pa to? So if ever that your diet is higher than the normal body intake. So for example, you do have your calories of normally for an individual, we do have 1,300 to 2,000 calories per day. So kung mas mataas doon, possibly, it would entail you a higher glucose or triglyceride content in your blood, no? For prolonged period of time. Kung lagi ka palang exceeding 2,000, ano kaya laging below 1,000 yung kinakain mo. So, it will reflect on those parameters of your blood. So next we do have specimen collection and handling. So in clinical chemistry tests are performed primarily on serum collected in gel barrier tube. Bakit kaya in gel barrier tube? So in order for you, so usually this is your serum separator. So usually, pinagse-separate talaga totally your plasma to your blood or even your serum to your blood, your order for them to survive outside body environment. Okay? Kailangan nila yun. No? Kasi nga, they are outside of the body, so they need some energy in order for them to perform still their vital function. So, ganyan. Okay, tests are also performed on plasma, CSF, urine, synovial fluid, pleural fluid, pericardium, and peritoneum. So these are your other bodily fluids that are being found inside the body. Four. So your synovial fluids are your joint fluid. Pleural fluid is your fluid found in the pleura, which are which encloses your lungs. Pericardial is more so found in the heart, and peritoneal is inside your intestine. So, ano nga pala nakalagay dito? Pre-examination variable. So, other than fasting. Okay? Sige. Then, serum and plasma are obtained by centrifugation for about 10 minutes. But it depends on the institution how long you will centrifuge your specimen. So, some institution requires like 15 minutes. Okay? And now, before you do centrifugation, you need to let it first completely flat. Now, in order for you to separate the blood components of your specimen. So it takes about 20 to 30 minutes before centrifugation to ensure complete separation of the cell and serum. So more so, it depends pa rin on the institution. I have encountered in my practice 10 minutes, you need to stand the blood for 10 minutes, then you punch it for 15 minutes. It depends on stand it for 5 minutes, then you punch it for 10 minutes. So, yeah. Okay? Bakit you need to separate it as soon as possible? As I said kanina, some of your blood cells, specifically your white blood cells, no, consume some electrolytes and even analytes inside your blood in order for them to survive outside the environment. Ideally, all measurements should be performed within 1 hour after collection. So if ever that you cannot perform 1 hour after collection, you need to separate it immediately. Okay? And refrigerate your serum or plasma in order for you to prevent decrease in analyte. But still, you need to assess variables in order for you to provide, if ever that your specimen will be tested after 8 hours. So, ano yung nangyayari dun sa analyte mo after 8 hours, even in refrigerated state. Okay? So, some entails you still the glucose is decreasing 0.7 milligram per deciliter every hour. Okay? So, like that. Yan. So, you need to know, of course, the storage and transport of your specimen. So, serum or plasma must be stored at rep temperature, which is 4 to 6 degrees Celsius, or freeze it at 20 degrees, negative 20 degrees Celsius, if analysis is delayed by more than 4 hours. Bakit less than negative 20 degrees Celsius? In order for you to completely stop possible chemical degradation. Okay? Kasi within refrigeration, temperature still, some metabolic processes are happening. Okay, during storage, ambient temperature, refrigeration, or freezing are the conventional method. And concentration of blood constituent in the specimen may change. Sabi ko nga, meron mga analytes na napoconsume even in stored temperature as the result of aeration process, including absorption to glass or plastic tube. So, some analytes are affected by your glass and plastic. Okay? Even protein denaturation. So, lower temperature will denaturate your protein. Okay? And even in high temperature. So, mas decrease ang yung protein. Okay? Water movement into the cell that causes hemoconcentration or even lysis of your cells. Okay? So, ng mga ganyang processes. So, kaya kailangan tama ang storage mo and transport ng specimen in order for you to still establish and reliable laboratory results. So, interfering condition in the measurement of analytes. So, of course, you do have your hemolyzed specimen. So, hemolyzed specimen appear red because of the release of hemoglobin from RBC. So, ano ba yung hemolyzed specimen? Your blood is already destroyed, or your red blood cell is already destroyed. That releases the hemoglobin content inside the blood. So, your serum or plasma appears red in color. Okay? Severe hemolysis causes a slight dilutional effect on analytes present in the serum or plasma. So, some analytes are declared if ever that you have a hemolyzed sample. Okay? Kasi your RBCs contain a lot of analytes. And that analytes will affect the concentration inside your plasma or serum if ever the blood is hemolyzed. Okay, ano pa? Ecteric specimen. So, when you see ecteric specimen, it appears yellowish. So, more yellowish because of the presence of excess bilirubin. So, mas darker yung pagka-yellow niya compared to a normal serum or plasma. Yes, yellow ang serum or plasma, but darker yung pagka-yellow. Like your urine. Okay? So, your bilirubin still contributes to the color of your urine. So, same yung nangyayari kay serum or plasma. Okay? Like in example, so it appears cloudy because of increased lipid. So, ito yung makamukhang may gatas. Okay? Mukha silang may gatas. Bakit? Because of your lipids. Increased fats. Okay? Like in examples. So, 4 basic disciplines in analytical chemistry. So, you do have methodologies within clinical chemistry. So, first is your spectrophotometry. So, or spectrometry. So, your spectrometry, for example, are your spectrophotometry, atomic absorption mass spectrometry. So, ito yung test or the methodology in order for you to conduct a test. And this is spectrometry, uses a spectrum of light. Kaya ang spectrum of light in order for you to isolate or have a reaction for a specific analyte. Okay? So, this is a spectrum of light. Okay, for luminescence, so you do have fluorescence, chemiluminescence, and nephelometry. So, this is more so the emission of light. So, your analyte is being excited, okay, or initiated in order for it to have a specific color reaction or color emission. See? Next is your electroanalytical methods, your electrophoresis, potentiometry, and amperometry. So this uses electric charge in order for you to have a chemical reaction. So you do have positive and negative poles, no? And you observe possible reactions. Okay? And then you have your chromatography. Ano yung mga chromatography natin? We do have gas, liquid, and thin layer. This is a color reaction. Okay, chroma means color. So, more on the color reaction. So, sometimes this is the more common test that is being done in clinical chemistry. Yung mga line. Okay? Colorimetry also, we do have kinds of colorimetry. Your visual colorimetry, which uses only eyes in determining endpoints. So, ano yung mga yan? So, kunyari, for you are doing titration. So dapat ang end product mo is pink salmon yung color. More than that, you exceeded the color reaction. So you just determine the color of the endpoint. photoelectric colorimetry. So you are using um, electric charge in order for you to have a good uh, color result. So you do have two categories, your spectrophotometry and your filter photometry. Next, you do have your Lambert or Beer's law. So these are specific disciplines in clinical chemistry that you need to know, specifically if you are doing spectrophotometric methods. So what is this? It is followed only if the following conditions are met. So incident radiation on the substance of interest is monochromatic. So ever that the color you are isolating is just one. The solvent absorption is insignificant compared with the solute absorbance. So of course, we are testing the absorbance and transmittance in uh, in spectrophotometry. So this will be further discussed in your clinical chemistry when you reach your third year level. If the solute concentration is within the given limits, so of course, yung mga concentration of our solute and solvents, optical interference is not present. So more so, this is concerned with your um, cuvettes or the container. So if ever that the scratches are not present, okay, markings, so yan mga yun, nakakapag-interfere kasi yan ng test. And chemical reaction does not occur between the molecules of interest and another solute or solvent. So ano, wala dapat cross-reaction to other analytes. So ano pa yan? Ano bang nandyan? No? So as I said, you do test for transmittance and absorbance. So what ano ba yung transmittance? So, this is a ratio of your radiant energy transmitted divided by the radiant energy incident on the sample. So this is the transmitted light from your photoreactor going to your photodetector. So kung ano yung nagpa-pass through, so that's the transmittance. Ano naman yung absorbance? So yung absorbance is the amount of light being absorbed by your analyte of concern. So kung ano naman yung nabablock na light, yung analyte of concern. Okay? So this is the proportional to the inverse log of transmittance. Mathematically derived from percent transmittance. So yan yung mga formula natin that are being used to get your transmittance and absorbance. So for your transmittance, percent transmittance is equivalent to um, initial transmittance and I forgot. I go times 100. Okay? Then for absorbance, you are equals to 2 negative log percent transmittance. Or negative log transmittance is equals to 1 over log transmittance. What are the ABCs on your clinical chemistry? So A is equivalent to absorbance. So this is equivalent to molar mass of absorbivity multiplied by the length of light through the solution multiplied the concentration of the absorbing molecule in solution. So this is also a conventional formula for your absorption. So this is an example of your spectrophotometry. So nakikita nyo, meron yung gauge. Okay, in order for you to isolate specific light components. Okay? So basic components of your spectrophotometry. So this is mainly being used in a clinical chemistry laboratories. So ito yung mga ginagamit natin for clinical chemistry lab. Okay? Ano yung components niya? Of course, you do have the light source. So usually this is a light bulb made by your tungsten. Okay? Or even iodide. I forgot the other one. What do you call this? Uh, Diode. Sorry. The diode. Okay? Device to isolate the light of a desired wavelength. So more so, this is your three sims. three things. Okay, so your cuvette, of course, this is the container for your specimen or sample. Your photodetector, so this will detect the light that pass through from the cuvette and your sample and measures, your transmittance and your absorbance. Okay, and the readout device which will transmit the value of your transmittance and absorbance into numerical values, and then the data system. So next equipment that you have inside the clinical chemistry laboratory, of course, is your pipettes. So I already discussed the pipettes on analytical chemistry, but for some that doesn't have analytical chemistry, so for micropipettes, you do have macro and micro. For macro, you are measuring more than 1 ml of the analyte or the sample that you are testing. So this is usually a macro pipette because the tip can contain more than 1 ml of sample. So micropipette is less than 1 ml. Usually this is being read as 2 microliters. So this is U N microliter. Okay? Advantage, of course, time saving. Bakit? You don't need to pipette like in the conventional pipette. Hindi na kailangan na titignan mo pa ng eye level. Hindi mo na kailangan dilinisin mo pa yung pipette because it has a disposable tip end. You just put the exact amount that you need. You will just push the button, okay? And you will have the desired amount. For safety, bakit? Conventional method of your pipetting, way back, decreases mouth pipette. So, through mouth pipetting yung ginagawa nila. So, more safe, ito, because no glass are present in your pipette, unlike your conventional pipette that are made of glass, and we do have disposable plastic tips. Stability, because of your materials that being used because of plastics, unlike your glassware. Ease of use, of course, I said, you just put your desired amount in the numerical value in your pipette, then you will aspirate and dispense the desired amount you need. Okay? Next, you do have increase in precision. Bakit? Hindi kailangan titigan ng eye level yung measurement. Sabi ko nga, lagay lang nyo yung number, yun na yun. Lack of required cleaning because of your disposable. So you do have types of your automatic pipette. So you do have air displacement, positive displacement, and dispenser or dilutor. So for air displacement pipette, so it relies on piston for creating suction to draw the sample into a disposable tip. The piston does not come in contact with the liquid. So meron sang parang air bulb sa loob in order for it to suck or create a suctioning drawing method on the specimen. So for the positive displacement naman, operates by moving the piston of the pipette tip or barrel. So, more so, ito yung the tip is in contact with liquid. Okay? And then for dispenser or dilutor, and your positive displacement pala has a negative pressure. So next is your dispenser or dilutor obtains liquid from common reservoir. So ito yung mga nakakabit sa bote. So these are your samples. This is your dilutor. So you cannot differentiate your positive to air displacement if you don't look inside the piston. So bubuksan mo pa yan. Yeah. Usually, they are interchangeably used. So, but this is dilutor. It is attached to a bottle. So you just put the desired amount here, then you push na pababa para lalabas here yung desired amount. Here, pipette tips na designed for use of air displacement pipettes. Yan. Ito yung mga kinakabit sa dulo. Ensure that the pipette is fitted snugly into the end of the pipette and free from any deformity. So you should check if ever that one na may butas dapat yan, hindi yupi-yupi, and clean. Partially displacement pipette uses strips that are made up of straight columns of glass or plastic. So what are the tests being performed in your clinical chemistry section? As I said, you do have enzymes and analytes that are being tested in your clinical lab, so such as ALT or alanine aminotransferase, which indicates elevated levels on your liver disorder. This is an enzyme found in your liver. Albumin, main protein that is found inside your body. This is decreased in liver or kidney disorder or even in malnutrition. It will be furtherly discussed on your clinical chemistry on your third year. Then your alcohol, also tested. Another enzyme, octamine, which is just an enzyme. DLP also, liver disorder. Ammonia, liver disorder, bakit? Your liver detoxifies your body. So elevated ammonia levels in your blood signifies the intoxication. The amylase, another enzyme, elevated in pancreatitis because your pancreas produces your amylase. Okay? Main organ for amylase production is your pancreas, but also your salivary glands produces amylase. ABG, of course, this is tested in your clinical chemistry section. This evaluates acidity or alkalinity and oxygen and carbon dioxide levels in the blood. Another enzyme, yung AST, for MI or even liver disorder. But most of the time, hindi natin ginagamit for MI because this is also produced by liver and mas marami coming from your liver. Bilirubin, of course, liver function or even hemolytic diseases. BUN, your blood urea nitrogen, elevated for your kidney. So this is one of your kidney function tests. So AST, ALT is being evaluated on your liver function. Your BUN, creatinine test for your kidney function. BNP or brain natriuretic peptide. This is also for heart. Calcium, of course, for your bones. Cholesterol for your coronary risk of diseases. Creatinine kinase or CKase. This is more so depending on the isoenzyme. So you do have CKMB, MM, and BB. So it depends. So more so your CKMB is being used for your myocardial infarction. This means muscle and brain. So muscle and brain. Okay. Other, so let's look on this table. So another for your creatinine is the creatinine. Okay, this is also used for kidney clearance, of course, for your glomerular filtration rate. We already discussed this on your urinalysis. Drug testing or drug screening, of course, for therapeutic drugs. Also for your drug testing, so yung legal drugs, your electrolytes, sodium potassium chloride, and carbon dioxide. For body fluid balance or your homeostasis. Your GTT for your early liver disorder. So more so we are using this for chronic alcoholism. Glucose, no, of course for diabetes. Glucose tolerance test, same, no, for DM or even hypoglycemia. Haptoglobin, used for hemolytic anemia and certain chronic disorder. HbA1c or yung hemoglobin A1c, of course, to monitor diabetes mellitus, as I said. This is a 3-month long glucose level. In the hemoglobin electrophoresis, of course, it detects abnormal hemoglobin such as your hemoglobin C, hemoglobin S, and more. So, high density lipoprotein assessed for coronary disease. So, this is your um, lipid profile. Your HDL, LDL, cholesterol and triglyceride are included in your lipid profile. For iron, of course, for your iron deficiency anemia, for lactic dehydrogenase, for your myocardial infarction, your even lung or liver disorder. Lead, for possible poisoning. Lipase, indicated in pancreatitis because your pancreas also secretes lipase that helps in your digestion of your fats. Then next is your lithium for your antidepressant drugs. So your lithium is being used as antipsychotic drug. Okay? Next is your LDL, of course, again, sabihin natin sa lipid profile. Magnesium, this is an cation. So sometimes this is also included in your electrolytes for neuromuscular excitability of your tissue. Myoglobin for myocardial infarction. Okay. Phosphorus also sometimes included in your electrolytes for skeletal and endocrine disorders. Your PSA or your prostate-specific antigen, this is being used to screen prostatic cancer for males. Of course. Then your protein. This is associated with liver or kidney disorder. But more so, we are using albumin as your main protein. Ano pa? Your total protein indicated for liver and kidney disorder. Triglycerides for your lipid profile. Troponin I and troponin T. Usually this is the one that we are testing in order for us to identify myocardial infarction or heart attack. So mostly for heart attack we are using I for screening, but in monitoring your myocardial infarction we use T. Okay. Then your next is your uric acid, of course, for your kidney disorder, even in gout, because this is a metabolic waste product. Other common chemistry organ or disease panel. So you do have the comprehensive. Usually this is being evaluated as your Chem 10 or Chem and so on. Bakit? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So Chem 10 to 14 yan. So usually, this is not included. Yung apat na yan. So ito lang yan. Okay? So hepatic, for hepatic profile, of course, sabi ko nga, ALT, AST, ALT, bilirubin, and direct protein are being evaluated, but more common, ALT and AST. Lipid profile, cholesterol, triglyceride, HDL, and cholesterol HDL ratio. Yan. Basic metabolites, you do have glucose, BUN, creatinine, electrolytes, and ionized calcium. And then for your renal evaluation, glucose, but more so it is just your BUN and creatinine. So this is the last slide. So what is the point of care testing? So your point of care testing or your bedside testing is being done bedside or not being done even in without the monitoring of your medicine. Bakit? You can do this all by yourself. So for example, here is your glucometer, okay, or blood glucose testing. So this is the procedure. So remove the strip from the container. So ito lang yun. The glucometer and then the strip. So just insert it, do dermal puncture, and then you just put drop of blood. And then you have already result. So that is just a point of care testing. Ano pa yung other point of care testing? So your bedside coagulation testing, your bleeding and clotting time. Okay? So yan mga yan. Yung kayang-kayang gawin bedside. At on emergency cases, so when I was working on a laboratory, we do have point care of testing for creatinine, sodium potassium, okay, BUN, troponin E, troponin I, no? Yung mga yan, meron ng machine na bedside. As in gan, parang kasing laki lang ng cellphone. No? And then you just insert the chip and you test the blood, the drop of blood. Okay? So, more so, point of care testing, you are using dermal puncture. So that's all for your clinical chemistry section. Okay, thank you.